Salams and welcome. I'm just reading an interesting, very, very interesting article this morning. This is news headlines coming out of Australia. They've done an extensive study, and these findings that they found in Australia also occur in first world countries like America, Canada, Britain, vast parts of Europe, Germany, and so on. But it also affects us here in South Africa, and the condition is known as dementia, right? When you lose your ability to now use your brain effectively. Now, it usually affects people who are elderly in age, but usually after the age of 60. But for in some about 10% of cases, even people who are under the age of 60 years old start getting things of dementia, symptoms of dementia. Now, when we talk about dementia, the most common dementia that people know of is a condition known as Alzheimer's disease. And maybe you got a family member that you're looking after, and it's very, very difficult. You need a lot of patience, you need a lot of sabr, and may Allah SWT will reward you. To have a patient with dementia in your house. Many of these patients, 60, 65, 70, 75, 80, and even beyond, they become totally helpless. They find it difficult to take care of themselves. Many of them need to have adult nappies, and then it's a cost factor. Many people cannot afford medical aid. So it is an extra burden on the family. But as Muslims, we know that by looking after your parents or elderly parents, it's a great reward. But this journal article out of Australia has mentioned that in their research they've done that 50%, listen to this, 50%, half the Australian population, they have fear of dementia. So they did a study. They asked the people, what is your biggest fear? What is your biggest fear as you get older? So they say our biggest fear is dementia, that we're going to lose it. We're going to forget the people. Imagine you look at someone that you love and you don't recognize them. Imagine you don't recognize your mother or your children or your best friends. That is the biggest fear people have. And the second biggest fear people have is to have a heart attack. Right? So these are the two biggest fears that people have. But what the study has shown, that even though there's so much attention being paid on heart attacks, they check your cholesterol, there's so many heart attack drugs, exercise, do A, B, and C, but not much attention is being paid to the brain. Now, because myself, I love the brain so much, and I've done so much programs on the brain, I find this absolutely fascinating. And let's look at some tips that you can do on how you can delay or prevent dementia. And the best way to do that is to start when you are young. You've got to start when you are young. You cannot start when you're 60, 75 years old, but at any age, even if you're 70 years old, 75 years old, if you do some of the things that I'm going to suggest, anything that you can do is going to benefit your brain, right? The brain is very, very powerful. But let's look at some of this article in this journal article, which says, dementia is an umbrella term which refers to the symptoms of a wide range of illnesses. And Professor Michael Woodward said, we need to start treating our brain with the same amount of respect that we treat our heart. Because people say, oh, you know what, you have a heart attack. No, let's fix up our heart. But what about your brain? You have a stroke, that's known as a brain attack. We talk about a stroke in a heart is known as a heart attack. A stroke to the brain is known as a clot to the brain is known as a brain attack. So you get clot here and you get a clot here, right? So the suggestion is that, and it depends. Some studies have shown they must do at least 200 minutes of exercise per week, follow a Mediterranean diet, have active social networks, and you need to stimulate your brain at least 20 to 30 minutes a day, do a lot of crosswords and those type of things. But very, very briefly, let's just look at furthermore, just some basic definition. What is dementia? So dementia is a syndrome that can be caused by a number of diseases, which over time destroy the nerve cells. It damages your brain cells, and it typically leads to deterioration in your cognitive function, your ability to think, to plan, to make decisions, and to process what is going on around you. Now, in many cases, people think it's part of the natural process of biological aging. They say, oh, you're not just getting old, he's forgetting things. But basically, there's an underlying dementia. Right? So dementia has got physical, psychological, and social and economic implications that affect not only the patient, but also the family and caregivers. So let's look at briefly some of the signs and symptoms. People will tend to forget things or recent events, losing or misplacing things, getting lost when you're walking or driving, being confused even in familiar places, losing track of time, difficulty solving problems, problem following a conversation when some people are talking, you're not sure what is going on, trouble finding words, you say, hey, I had it on top of my tongue, what is going on, difficulties performing familiar tasks. And then there's also changes in mood and behavior. You get feelings of anxiousness, stress, sadness, anxiety, that you're losing your memory, what is going on. You get personality changes, inappropriate behavior. You withdraw from social activities. You don't want to go out anymore. You're less interested in what is going around you. But different people are affected in different ways, and different people respond in different ways. So the most common type of dementia is known as Alzheimer's. This affects about 70% of the people. Then you got something called vascular dementia, depending on the damage to the arteries in the brain. And then you get something called Lewy bodies. Don't worry too much about it. It's that protein affecting some of the nerve cells, right? So dementia may also develop after a stroke, or maybe in some cases with patients who got HIV/AIDS, or as a harmful use of a lot of alcohol, repetitive physical injuries to the brain. Some people who've been involved in rugby or in boxing matches, and that's known as chronic repetitive or traumatic encephalopathy, right? So let us see what we can do to help avoid dementia or delay it. Some of the common things you can do: please be physically active. You don't have to go to the gym every day. Don't look at your watch and say, hey, I must do 45 minutes, I must do 45 minutes, I must do an hour. No, do as much as you can. And you don't have to, if you can't afford to go to the gym, you don't have to worry about the gym. You can walk around in your house. If you've got some staircases in your house, run up and down the stairs, walk around your garden, go around for the walk in your security estate, or go for a walk in the park, go for cycling, squash, tennis, whatever you can do, pedal, anything that keeps you physically active, right? And today, in today's time with social media, people are just sitting, and this is especially for the Gen Z. Please remember, the Gen Z of today, you guys are healthy and fit today. Before you know it, you're going to be old like me. Before you know it, the time is going to go like this. So I'm appealing to the Gen Z to prevent dementia in old age. Please start walking from today. Start exercising from today. Otherwise, we find the Gen Z are just sitting, watching TV or watching their cell phone, and just eating popcorn and eating crisps and eating all sort of junk food. And you find that all of it affects your heart, affects your brain, it affects your organ functions. So please remember, exercise is very, very important. The second thing is take part in activities with social interactions that stimulate the brain, right? If there's a wedding or a social function, try and go for it. So these are all important parts. So I don't want to talk too much about the treatment or the medication. That you need to discuss with the doctor. I can't give that over the internet, right? Then so stay physically active, eat healthy foods, try and stop smoking. I know it's difficult for many people, but alcohol is very dangerous. Alcohol is very dangerous, especially in our country, South Africa. Alcohol is a pandemic. You know, we have talk about a COVID pandemic, but no one is talking about the pandemic that's affecting us every day, which is alcohol. Alcohol is contributing to our rape and our murder and our domestic violence and HIV/AIDS and sexually transmitted diseases. So please get rid of alcohol. Otherwise, it's damaging your liver, it's damaging your brain, it's causing you dementia. You can't think anymore, you don't know what is going on. So many people in this country got undiagnosed dementia because of alcohol. So please take that alcohol bottle and throw it away. Get regular checkup with your doctor. Write down, make sure you got a regular hobby. Try and get your brain active, whether it's calligraphy, writing, or doing some arts and work. Get your brain active all the time. Try and do new types of things. Spend time with family and friends, and try and see how you can help other people. When you're helping other members of the community, that way your brain becomes active and stimulated, because then you have meaning in life. Stay well, look after yourself. Alhamdulillah.